Welcome to Bright Health podcast. My name is Dr. Ali Day. Today I'm going to discuss one of the patients that I have seen recently about his chronic headaches. Paul, not his real name for obvious reasons, is 66-year-old gentleman who had a number of comorbidities, problems, namely enlarged prostate and his marker of prostate cancer PSA is slightly elevated under investigation by urologist, has few lipomas on his arms. Lipomas are little fatty deposits that can cause aesthetic issues in some part of the body, and I referred him to a surgeon for removal of some of those benign lesions. Also, osteoarthritis of knees and hands. I saw him last week for mild chronic headaches. And to investigate further, I arranged MRI of head and a series of blood works that I'm going to further elaborate on those results today. MRIs of the brain showed that there is something called a small meningioma that might explain his headaches. A small meningioma. It was revealed on MRI. What is meningioma? Usually a benign tumor of membranes of the brain that, depending on location and growth rate, it may impinge on vital nerves or compress the brain, causing disability. They may even become life threatening. I referred him to one of the best neurosurgeons in Brisbane for review. And I'm not bothering you with the whole feedback, but in nutshell, he said these are the just these are the exact wording. I've got the report here. This is the exact wording. Um, I will follow up with a 6 months MRI and clinical review. We can then consider annual and then 2 yearly scans. So this is a management of a potentially serious issue, just monitoring. And if it gets so big that becomes potentially dangerous, then I intervene. MRI report also revealed moderate small vessel ischemic disease. A small vessel ischemic disease, meaning small vessels of the brain get dysfunctional so they cannot deliver oxygen, essential nutrients to the brain. And byproducts of metabolism, junks, CO2 accumulates inside the neurons. Double whammy. Not only good stuff doesn't arrive to the neurons of the brain cells, but also bad stuff accumulates which cause disaster, increasing the risk of neurodegenerative disorder, Parkinson disease, Alzheimer, dementia, etc. Now I tell you about blood test. Marker of inflammation, homocysteine, CRP, liver function test, all high. Patient has thyroid antibodies. That is another marker of inflammation. Fasting insulin and average blood sugar marker or HbA1c elevated and nutritional status of Paul in terms of zinc, a specific type of magnesium, vitamin D were low. So in summary, Paul has suspected prostate cancer, lipoma, osteoarthritis, a type of brain tumor, meningioma, dysfunctional vessels of the brain. Western medicine practitioners look at all these maladies as a separate entities. For example, urologists monitoring his PSA levels, neurosurgeon monitors his brain tumor, surgeon removed lipoma, and there is no cure for ischemic vessels of the brain. They say, oh, you're getting old. But when I look at all these patients, when I look at Paul, as a functional medicine practitioner, all these problems arise from one cause, and that is significant inflammation. As I explained earlier, markers of inflammation were elevated and levels of biochemistry related to nutritional status were low. And how come all this happened? Gut health. As Hippocrates said 2500 years ago, all disease start from gut. Paul is eating empty, bad calories, stuff the body doesn't want and not providing the right nutrient, giving a starch, ultra processed carbohydrate, sugar, and not providing the right food. One of the most important marker I checked was insulin for Paul. That correlates with amount of carbohydrate, sugar he consumes on a daily basis. This is a potent growth factor. Insulin is a potent growth factor. Tells everything to grow. And the fuel/sugar for abnormal growth is ready. Remember I told you Paul has lipoma, growing fats below skin, prostate cells are growing out of control, meningioma is growing in his brain. All of these things happening due to poor nutrition and lifestyle is the main cause of dysfunctional vessels of the brain, leading to neurodegenerative issues, Alzheimer's, Parkinson's, dementia, Lewy body dementia. When you look at the gut under microscope, I show to my patients look like this. These are villi or villi, and on top of villi we have little teeny tiny projections, microvilli. And these are the human root in the soil of the poop and microbiome and fungi and viruses. If that soil is deficient, if that soil doesn't have the right ingredients, zinc, magnesium, silica, copper, iron, it doesn't have the right microbiome, every bits and pieces of the body start to suffer. So the issue goes to the health of that soil in the gut. In my management, I go right into his gut health, removing bad stuff and put the right stuff in. Helping him to understand the right ratio of macronutrients, for example, protein, fat, and carbohydrate, and how to get micronutrients and minerals from food. I help Paul to understand the important role of exercise, importance of sleep and stress management. Monitoring as a strategy doesn't help, as it waits for a disaster to happen before any meaningful intervention. In current medicine, there is no role for prevention. And unfortunately, so many of us doctors have zero to little training in terms of prevention, nutrition, and lifestyle modifications. My name is Ali Day. I work in North Brisbane Redcliffe Beach Clinic, and I try to provide insight and valuable information through this channel. Stay tuned. See you later.